Good morning, everyone. Thank you for joining us for this special briefing on the University of Arizona campus reentry. Today, President Robert C. Robbins will be joined by Dr. Richard Carmona, 17th Surgeon General and Director of our Reentry Task Force, along with Pima County Health Department Director, Dr. Terry Cullen. They will be discussing the university and county's efforts to address the issues of COVID-19. Before we get started, I would like to tell the members of our press that if you are interested in asking a question at the end of today's remarks, please make sure you write your name and your news organization and then raise your hand in the chat, and I will ask them on your behalf. With that, I'd like to turn this over to you, President Robbins.
Thank you, Holly, and welcome everyone. We had not planned to hold a briefing this week, but a lot has transpired over the long weekend, and we wanted to share some updates. We'll focus on our testing program, our strategies to encourage compliance with public health guidelines, and how the university and Pima County are working together in all of this. As Holly said, we're very pleased to have Dr. Theresa Cullen, a proud Wildcat and a member of our faculty, joining us to discuss our partnership. You likely have seen the news over the weekend that 15 of 126 COVID-19 cases we reported last Thursday from our testing program were false positives. This result did not make sense after we began contact tracing, so we retested those samples. I think this is a sign that the test, trace, and treat ecosystem we've established is capable of self-correction. Incongruous results from different parts of the and 1,700 PCR tests every week. Antigen test results are available within an hour, in most cases, 2 hours at the longest. To be clear, we're continuing our testing program for off-campus students as well as faculty and staff. There was an erroneous report that we were now only testing students in our residential dorms. This is simply inaccurate. As I indicated at last week's briefing and in communications to the university, Dr. Ian Pepper's wastewater-based epidemiology program allows us to deploy test resources strategically. A positive wastewater test in a dorm allows us to test students in that building to be more quickly identified as asymptomatic cases, which of course is what we're trying to do. Dr. Pepper is working with Chris Kopak's team in facilities management to test each dorm 3 times per week. And we're also looking at the feasibility of expanding wastewater-based epidemiology to off-campus locations. We also work with the county on contact tracing. Student and faculty members in the Mel and Enid Zuckerman College of Public Health are working with Pima County Health Department as contact tracers for the campus community. Additionally, the COVID Watch app is available to residential and business areas near campus. As a reminder, this fully anonymous app lets users know if they have been near someone with COVID-19 and with what level of risk. If you live or work close to the university, please go to the Apple App Store or the Google Play Store to download and search specifically for COVID Watch Arizona. Our partnership with Pima County and the City of Tucson also includes initiatives to encourage compliance with public health measures and to hold students accountable as needed. We're collaborating with Tucson city officials to respond to reports of off-campus gatherings that violate city ordinances and undermine health and safety guidelines. In addition, a partnership of neighborhood associations, Tucson Ward Offices 3 and 6, Pima County District 5, Tucson Police Department's Red Tag Unit, and the university's community relations team is responding to complaints about off-campus student houses not following basic public health guidelines. We have also responded to all complaints received to date. At the end of last week, 13 homes were visited from 9 different neighborhoods. We have shared details of the university's and Tucson's mask requirements and face covering requirements and test, trace, treat options, as well as what we do if students feel ill or need assistance. Neighbors have invited students to join their neighborhood association activities, helped answer questions about trash pickup, and provide important tips about parking in the neighborhoods. The Red Tag unit has answered many student questions about the process for receiving red tags and the consequences, both from the city and the university. We are working with off-campus housing to provide resources for students and for housing managers. This includes signage on the importance of face coverings, hand washing, and other public health practices for off-campus housing. And we provided a seminar for off-campus building managers and sorority and fraternity houses on isolation, cleaning practices, and other COVID-19 related mitigation and response. Finally, as we said throughout the reentry planning and implementation process, our evaluation of the university's best course includes both internal and external factors. Of particular importance is the capacity of the Metro's area healthcare system. Currently, we are not taxing the county and medical resources. ICU bed availability that Dr. Carmona will go over later across the Tucson area is at the highest level since early June, meeting the lowest number of patients in the ICUs. And ventilator usage is at a 3-month low. To date, we are unaware of any reports of university students, faculty, or staff hospitalized related to COVID-19. On our campus, isolation housing has 91 isolation beds currently occupied out of a total of 418 beds that are currently available. So that's about 20% capacity that we're using currently. And we're offering isolation for off-campus students as needed. Our surge capacity is 600 beds and up to 1,000 if we make use of local hotels. Currently, 90 dorm students and 1 off-campus student are in our isolation dorm. We will have cases as the pandemic continues. We've known that all along, likely until a vaccine is widely available. But I would even say once we have a vaccine, we will still have COVID-19 with us. Most people will hopefully take the vaccine, but it won't be totally effective. And some people will choose not to take the vaccine. So all the things that we're talking about currently, we're still going to have to do, even when a vaccine becomes available. The last thing I'll say is that we're going to push really hard because, as Dr. Cullen and Dr. Carmona very well know, we're entering influenza season. And I've talked to many people who have already gotten their influenza shot. We are going to strongly encourage, if not mandate, that everyone at the university have an influenza shot for this year, because it's going to be so important as we enter the regular flu season. We need to do everything we can to minimize the spread of this very highly contagious and transmittable virus that can be deadly, especially to the most vulnerable population. There's no apparent transmission from the university to the broader community. Pima County case data as of August 30 shows a slight increase in 0 to 19 and 20 to 29 age groups, but decline in other age groups. We'll continue to work closely with Dr. Cullen and the county, the city of Tucson, and our partners to both evaluate the public health conditions of our community and to respond appropriately. I will say that there is a lag in the data, and all of us on this call certainly expect that there will be a spike based on the activities that we've observed over the last week and specifically over the weekend. Hence, why we're here today. We'll follow up, I think, Holly, with our regularly scheduled briefing on Monday, but I'll turn it over to Dr. Carmona, who will then introduce Dr. Cullen after he goes through some of the data.
Good morning. Thanks, Bobby, and thank you all for being with us again for these important meetings so that we can inform the community of all of the challenges that we are facing and how the university is responding and working with the city and the county to deal with these public health challenges. Can I have the first slide, please? So as you know, on our weekly, we will go over the 7-day averages and look at what's happening with Arizona cases. And overall, the state has done pretty well, but we're starting to bump up. And as the president just said, we have some concerns about the lag of data as it relates to what we expect is going to be a bump after this Labor Day weekend. But overall, the state has done pretty well going from mid-July down into early September. But we're seeing some uptick. A lot of it we'll talk about in just a minute. Next slide. Again, where new cases are low and staying low, this is a composite of states across the country. And the Arizona numbers, again, look good as we discuss them every week. However, the lag here is that we haven't gotten all the data in yet. And we expect that there's going to be a little bit of a bump on that Arizona curve, which has been going down pretty consistently over the last month or so. Next slide. Again, as we look at the Pima County cases, the numbers were really pretty good and right up to about September 7th. But we expect again that we're going to see a bump there. We don't know the magnitude of that yet, but based on the cases we're seeing here, the cases in the community, hotspots around the community that Dr. Cullen and her team have been looking at, we expect that there will be an uptick over here. And that's nothing surprising. As you know, throughout the almost 3 months that the president and I have had these press conferences, we've repeatedly said that we can prepare the campus and ensure that there is every public health precaution in place to decrease transmissibility. The big risk factor is the social behavior of young men and women who are used to coming to a campus and socializing and going to classes and all of the usual college activities, which is the most difficult thing to change are those social behaviors. Next slide. As the president alluded to in his remarks, the ICU beds continue to drop, meaning there are more beds available to us to surge. And we need that because we know during the flu season that, in fact, there will be an increased demand for beds in general and ICU beds and even a few ventilators every year. This is usually a low time for our bed utilization toward the end of the summer and the beginning of fall as the flu season kicks in. Next slide. Ventilators in use are down, but even as important is that of the ventilators being used, we're seeing less COVID patients using ventilators. So those are all good indicators. As I've said every week, and as the president has said, that's no reason to become complacent. We have to bear down, mask up, and even work harder now because we know with the flu season coming, more people coming into town from colder areas to escape the cold, it will place us at higher risk in general throughout the whole community. Next slide. The RT measure we speak about every week, we're still looking pretty good in the green. Being below 1 is a desirable number to demonstrate less transmissibility. But as we said, the numbers that are coming out the last few days are lagging. We'll see that next time. We expect that RT was going to rise again, and we have to do everything we can to decrease the transmissibility. So this is a moment in time that we're seeing now. We're grateful that, as you can see, going back quite a bit, our IT has been, admirable and among the best in the country. But right now we have to even bear down more because we know with the exposures happening this Labor Day weekend, people traveling, students coming in, vacationers, whole host of other reasons that there's an expectation that this number could rise again. And that shows that there's increased transmissibility. Next slide. As was mentioned earlier, the Test All, Test Smart is one of the platforms that we are living with our program. As you can see, 118 positives of 1627 there. We're running anywhere between 7 and about 8.5% as far as the positivity. And so we're doing everything we can to decrease that transmissibility. The important thing to remember is, again, and I want to emphasize that, in December of last year and the early part of this year, nobody had seen this COVID virus. Every day, we're evaluating new scientific data, everything from treatment, from antivirals, vaccines, testing. When we first started, there was a PCR test. It took weeks to get an answer. We're down now to minutes on some tests, and the new saliva tests even faster that are being looked at by the FDA. So the science is evolving rapidly due to the innovation here at the University of Arizona and other scientists around the world, where innovation is being driven by the challenges we're facing every day. So we will continue to provide the most contemporaneous information to you in all of our press conferences and news releases from the president. But I just want people to realize that these are going to change almost on a daily basis, because we continue with our city and county partners and state and national partners to be able to review emerging science and technology and incorporate that into our messaging, so we always represent the best practices. Next slide, please. And again, I think the president alluded to the fact that we're probably at about 20% of our capacity, about 1 in 5 beds being used. We have the ability to surge more if necessary. We hope not to, but as we reported on a weekly basis, as we look at our program, our framework, which is really based on the national response framework, surge capacity is always important, the capability to surge and factor in modeling any and all hazards that could cause us to need more capabilities in the community or on the campus. So these are numbers we track very, very carefully, because we always want to make sure that we're able to surge based on unanticipated, urgent situations that could emerge, like the flu, like people getting sick, or a surge in cases because of transmissibility. So at this point, I want to introduce Dr. Terry Cullen, who is a Wildcat, and also a retired U.S. Public Health Service officer, a career which culminated in her as an assistant surgeon general. So we're real fortunate to have her in the community, joining our faculty at the university, but also because of the extensive operational experience she's had in just about every kind of hazard that the nation has faced, from pandemics, epidemics, infections, emergency operations. So Dr. Cullen, thank you for coming home again. Thank you for bringing your wisdom to us, and we are very fortunate to have you as a partner.
Thank you so much, Dr. Carmona. First off, I want to acknowledge that Dr. Carmona was my boss when he was the Surgeon General, and I was an Assistant Surgeon General, and it was a wonderful opportunity. So what I want to share with you today is what our relationship is with the university, the city, and the county. And I want to remind you that the Pima County Health Department is committed to ensuring the safety and wellness of all members of our county. Obviously, the university is a major partner for us, and we work very closely with them. But it's important to recall that as we approach our relationship with the university, we are doing that in a way that we ensure protection of our vulnerable populations, the other members of our community. And we align ourselves with the best and the brightest at the university, at the city, and with other industries throughout the county. I want to talk to you briefly about what we're doing right now based on what Dr. Carmona and Dr. Robbins has shared with you. I'm going to invoke the test and treat. As you know, we work closely with the university and the city. There is ongoing testing right now to accommodate the needs of the university. The university has embarked on a very widespread testing program. The Pima County assumes that our role is one to be synergistic with the university. So what that means is we look at the places where we know there needs to be testing, and the university right now is not testing, or the city is not testing. So combined as a group, we ensure that there's adequate coverage of testing. Now, this does include off-campus housing. For us at the county level, we've been working with the Greek community, and we've been working with the other community-based student housing that the city had not tested up till today. What you'll see in the next 2 weeks is very, very aggressive testing in multiple locations throughout the city that will ensure that we have a pandemic approach and coverage to create what we call a COVID resilient community. That's really our goal, is to work with the university, work with the public health advisory team, of which we're a member, to help guide the data, the collection of the data, and what the data means so that we can make appropriate decisions. So we have testing in terms of case investigation and contact tracing. Dr. Carmona and Dr. Robbins both talked about this. We work closely with the School of Public Health. We share data back and forth. We ensure that through that, we have what we call a layered approach to it. So everyone in the community that is a case who's affiliated with the university gets appropriate case investigation and contact tracing. And then I think to go to what Dr. Carmona also talked about, the positivity and the number of cases. So we are concerned that we are going to see an increase. I would be misleading to you if we didn't anticipate that happening. What we're trying to do is ensure, because we know that will happen based on experience already at the university, but experience throughout the United States, that we put in place appropriate mitigation. To do that, we're working closely with the Public Health Advisory Group that helps inform Dr. Carmona and Dr. Robbins. They've developed a series of recommendations. We've also developed a series of recommendations that we will be working with the university to evaluate and to figure out what is the best way to approach. We know that there may come a time when there really is a need for restriction of some movement based on mobility, and how do we ensure that especially the neighborhoods around the university stay protected. And at this point, what we know is we've had conversations about that. There are no decisions about that, but we will be looking at that. When we work with the Greek system, who, as an aside, have been wonderful to work with, and I want to acknowledge their willingness to work closely with us. Our approach has really been what we normally use, if you've involved at all with our consumer food safety, is an approach of education. Can we educate you? Can we ensure that you have enough tools to be able to mitigate and implement what is needed? And that's been our approach up till now. We are aware that there have been certain situations, and I'll invoke some of the pools situations around the university where we have done some early evaluation, and we are seeing situations where we know there is in compliance with the best recommendations for COVID. And once again, we will be moving forward in the next few days to try to figure out what's the best approach to that. Once again, our real goal is to protect the students, protect the faculty and staff, but be able to assure the Pima County community that we have their best interests, that we want the university to be successful. And at the same time, we want to bring all of our abilities, our data science, our understanding, our workforce into play so that we can address what we know will be a spike. And let's see how we can mitigate that the best way we can. The other thing I really want to just mention is the sense of layered mitigation, and Dr. Robbins talked about that. Layered responses. We've been working with our K through 12 schools and our businesses in the community. They're aware of that. What that means is we all do the best we can, and you saw on Dr. Robbins beginning video, remember the 3 W's, remember those things that I think we know from the county health perspective, people are all getting a little bored with. They wish it was over. It's not over. No. And actually, this is a critical time for the community, a critical time for the city and the university for us to remember that we are collective. We're a community-based response to a pandemic. And thank you guys for letting Pima County be a part of this.
Yeah, Dr. Cullen, I really appreciate those remarks. That was brilliant, and I'd asked you before if you had prepared remarks written down, and you said no. So that was beautiful that you delivered that off the cuff. Obviously, this is your life, and you live it every day. And thank you for the work you do at the university in your faculty capacity, but also working with our public health and medical and nursing pharmacy faculty, and being a part of the public health advisory task force that meets with Dr. Carmona and the ICS team every week. You know, we've been at this since March, planning for this day, and we've been doing a lot of education. I've been doing a lot of wash, cover, stay away. I think we're moving into a phase now, though, Dr. Cullen, where we're going to have to, we've done a lot of education. We've done a lot of asking begging. I've actually begged, will you please just follow the rules? But now I think we're getting to the point where we need to start having some more consequences for behavior that we know. And it's not surprising. Look, it's 112 degrees outside. There's a pool. There are people. They're at college. They want to have fun. I understand that, but just not right now. And so we've discussed and we're aware of parties that are going on. Even and I agree with you. The Panhellenic community has been incredible to work with, but there's a problem. The numbers that you and I and Dr. Carmona and Mr. Huckleberry spoke about this morning are alarming to me. So I don't know if we're into the phase yet. I think we're very close to the phase of where those houses are going to just have to be quarantined. We're just going to have to restrict the activity in the community of those individuals, because the numbers that I saw, I mean, they're running, you've got the numbers there, but 10 of 21 in one house, 19 of 30, 15 of 35 positive. I mean, essentially, those individuals that are in those houses, I mean, we're beyond, well, we've got a little sun porch or a floor that we can segregate and isolate people away from the rest of the house. I mean, these numbers just show to me that we're not doing a good job of controlling the transmission of the virus. So I look forward to working with you, with our faculty, with our staff, and our students to really increase now we're gone from the prevention stage into the real treatment phase.
Can I respond?
Oh yeah, please do.
So I just want to remind the community at large, the business and the K through 12 schools know this, that we track positivity rates. And when our positivity rates are more than 10%, that's when we were in a shelter in place, not moving very much. So when Dr. Robbins shares these percentages or absolute numbers at some of the houses, they translate into positivity rates that are far beyond 10%, in one case 60%. So that means 6 out of 10 people, if we tested whatever number, 6 out of 10 would be positive. So these rates are actually alarming to us, and they're alarming to the county, not only because of the concern of transmission, but also this potential to have very severe negative consequences on students' health. And I want to remind everybody that right now, the data on long-term consequences from people that are even asymptomatic is unclear. But we are getting some early information that in the young adult population, even if you never felt you were really sick, there's a significant number, up to 30% of people that may have some cardiac inflammation that's found later. We don't know what that means, and I would defer to Dr. Robbins. He knows a lot more about hearts than I do. But what it points out is how serious this is, that even if you are feeling well, the fact that you can transmit to another is critical. But in addition, the long-term consequences for you are unknown. And I do want to echo what you said, Dr. Robbins. I think we are getting quickly to a situation where we will have to take a more aggressive stance in terms of somehow limiting people moving in and out, decreasing that happening.
Yeah, I made rounds the other day at Banner, and I was asking how many, and the number of cases in the ICU are definitely down from the peak, no question about it. But I saw 40 and 50-year-olds that were otherwise healthy that were in an ICU. One individual on ECMO for over a month, waiting for a lung transplant. There were 2 cases that I was told about of myocarditis that you're describing, and 1 case of acute cardiac tamponade that required emergency drainage of the fluid from this inflammatory response around the heart. So these are real issues, and I think that I think that most of our students will likely go through this without having any real symptoms other than maybe fatigue or flu-like symptoms. The problem is they could come into contact with someone at a grocery store, someone at a restaurant, their grandparents, one of our faculty members who are in a higher risk category, whether it be by age or they are being treated for cancer or they have some immunodeficient syndrome. And there are going to be some students who have undiagnosed immunodeficient syndromes and they get this virus and they could die from it. So that's why we're taking this so seriously. And I appreciate you being with us today. Dr. Carmona, you've got any observations about what we've been discussing?
Yeah, I do. And I thank you. And again, thank you, Terry, for being with us. You know, one of the things I'd like to do is maybe put it in context a couple of ways. First, this whole idea of isolation and quarantine is actually kind of foreign to most people. It's actually a theoretical concept that you rarely have to invoke, but often learn about it in school, medical school, nursing school, public health. Unfortunately, or fortunately, Terry and I have both had the opportunity to be involved in global health issues where we've had to use quarantine. And it's a very onerous option because you're depriving a person of the right to move to protect the greater society. And there are huge legal implications. And the reason that I bring it up is people have said to me, well, Rich, why don't you just quarantine those people and do this? It is not that simple. It's an extraordinarily complex issue that involves dealing with the general counsel, involving public health people, involving the community at large. But to your point, and the point that we've made repetitively over all of our press conferences, we model this into all the things we've done over the last few months. What is the worst case scenario? That we have an outbreak that we can't control because certain people refuse to comply with the public health standards. As you said, you have begged people. I've been with you when you've been directly or indirectly begging people, please conform. But we're giving you a chance to keep your university open so that you can do all of the things that you want to do as a student, but a little differently now in a COVID world. But you have to help us to do that. We've prepared the campus for you. We've done everything that we could possibly do to inject public health practices into a physical space we call the university. Now it's up to you, students and faculty and staff, to do that. And as you said, and Dr. Cullen has emphasized, we're at a critical juncture, a pivot point here, that with these early numbers now, if these bumps occur as we anticipate they may, we will have to shut things down. And you said that from the very beginning, Mr. President, you know, when it was a theoretical consideration. But again, Terry and I know, in doing this modeling and things we've worked on locally and globally, you always have to be thinking ahead of what might happen that's bad. What is the contingency? How do I surge? How do I protect the greater population? That's where we are today. And we're real fortunate to have Dr. Cullen with us because there are really few people that have had to operationalize these complex issues into saying we must quarantine now and understand the implications and the challenges it presents when you do that. So we're not taking it lightly, but I think it's important that we educate our community as you have, Mr. President, and we continue to let them know the city, county are working together, and in concert, we recognize we may have to make those decisions very shortly, depending on how these numbers continue to roll out. So again, we are very fortunate to have Dr. Cullen with us and on the team. And, you know, it gives us a much deeper breadth of experience where for most, these are just theoretical considerations. It helps to have people who have been in the trenches and have to do this, not only locally, but globally.
So Holly, we would love to continue this, but let's move on to the question and answer phase because that's always the most fun, and we like hearing the questions. But before we go there, you know, when we were in the virtual green room, we were talking about the measures that the University of Wisconsin took recently, and I think they were spot on around limiting mobility on the campus, and so. By Monday, I think that we'll have some announcements. So we're, you know, if you like what you're hearing today, tune in on Monday because we'll have good stuff for you. So go ahead, Holly.
Good. I look forward to implementing that plan right away, President Robbins. Our first question comes from, I bet you can guess, Charles Fishman from the Atlantic. Go ahead, Charles.
Good morning, everybody. I guess I have two questions. Can you guys hear me?
Yes, we can, Charles. Can you do one question and then we'll answer and then do the second?
Sure. If Holly will let me, that's good.
Bet.
You guys have tossed out a few dramatic numbers and cases this morning. How do we get the details pinned down? How many Greek houses have outbreaks, and how big are those outbreaks, and what has become of those fraternity and sorority houses? I mean, President Robbins, you said one has 10 of 21, one has 15 of 35. Okay, are either you or the county going to provide, here's the list of 17 Greek houses, 13 of them have outbreaks, house by house, here's what's going on. Of the 13, 9 are locked down. What can we find out that has a little more specificity?
Yeah, Holly, I think we're talking about dorms. I'm hesitating a moment here because I'm not sure if we can identify the houses, but Charles, we'll get that information. But Holly, can we?
I think we can give general numbers of how many houses currently are infected, but I don't think we can give actual names of those houses for HIPAA and FERPA reasons. And Terry might know.
Yeah, I can, and I would agree with that. I don't, the approach the county has taken, first off, is to ensure that we have appropriate intervention. And I'll talk really briefly about that. We are aware of a number of houses, and I'm going to defer to Holly whether I can share that exact number or not. I don't feel comfortable at all sharing the names, but let me tell you what happens when we identify a house. The houses are identified in conjunction with the university and the county, and they're based on the percent positivity. That's how we make a decision. We've been using over 15% positivity in a house, so it's independent of the absolute number for the denominator. It really is related to that value. As soon as we're aware of that, we work closely with the house. We have what we would call a team meeting. The public health people on campus and myself representing Pima County, or anyone representing Pima County, do a meeting where we once again focus on education. We make sure people are aware what needs to happen. We evaluate what is happening with certain of the environmental things, how quick the air conditioning is going, what we're doing for food, what we're doing for housekeeping. And then we, in essence, without invoking the word quarantine, but we're quarantining the house. We're asking people in the house who are positive to isolate, and we work with them what's an appropriate way for them to isolate. And then we ask the other people with the assumption this is congregate housing. They're now all contacts, and we invoke quarantine for contacts. So you can think of it that way. That's what we do with everyone for 14 days. We ensure that there's testing at day 5 or 6 after day 1, which is the day that we've done an intervention. And then we work closely with the group, and we work closely with them in terms of how many days is quarantine. As you know, quarantine can get kind of funky. I always need a calendar myself, but we make sure that they have appropriate support for that, and that's been our approach up till now.
But Charles, I think that we know of 3 where there are major issues, and we've been in contact with them, and there'll be more to come. What's your second question?
My second question is, if you look at the test data since last Monday, you all have reported 422 positive tests. That's 10 days. I'm just talking about antigen tests, 422 positives, and you have 90 on-campus students in the quarantine dorm. Of the 422 positives, how many of those are people on campus? How many are off campus? And is there actual on-campus person-to-person community spread? Clearly, there's off-campus person-to-person community spread, but have you found related cases on campus where people who are infected and live on campus are infecting other people on campus? So
Yeah,
what's the split?
Yep.
What's the split? And is there on-campus transmission?
Yeah, I don't know. I don't have the exact answer for that, Charles, but I'm assuming that there is on-campus spread. Dr. Cullen may know through contact tracing whether that's the case, but maybe she can answer that. But Holly, we'll track that down. I think, Charles, you're always on the numbers very well. But I don't know that we mentioned how many tests we've done. Is this in the last 24 hours? We did 1,704 tests, and there were 150 positive. And that's an 8.8% positive rate. So that's just in the last 24 hours, Charles.
Let me just make a comment, Bobby, and I certainly want to hear from Dr. Cullen as well. Charles, the challenge in all of this is it's very difficult sometimes. You're doing the tracking and tracing. For instance, we have a student that turns positive. You find out they've been into the community 3 times. They ate at a restaurant. They went to their friend's house. It's very hard. And then all of our students that can't come in, as you know, the protocol was they get tested, and the day they come in, they're negative. Otherwise, they go to one of the isolation rooms. So we know that. But yet then they start to turn positive. But and that's the importance of the partnership we have with the city and the county, because they're not living in a bubble. This is not the only place they go. They cross the street, they go to see a friend, they go to a restaurant, they go to a fast food location. And so it's often very difficult for an epidemiologist to say, here's where you got it, right here at this day and this time, because of all of the movements of a person. So I'll turn it over to Dr. Cullen, though, but this is not just here. It is a confounding challenge for every public health professional when trying to answer questions like that.
Yeah, I would echo that. I think we can safely say that we've seen congregate housing transmission in some of the fraternities or sororities where we tested and we were negative, and 5 days later we were positive. So I feel comfortable with that. However, this points out a much larger question, which I really want to remind people of, about contact tracing, and it's what Dr. Carmona is talking about. If a case does not give us who their contacts are, even if we then see somebody that might have been a contact is a case, we cannot connect them. We have to have some environmental, what we call epi-linkage, to make sure that there is that transmission there. And I want to urge the students that may be watching this, as well as the community at large, that if you are a case, you share your contacts with us, because first off, that's how we're going to stop transmission. But secondly, it's how we get some sense of the percentage of transmission that is occurring. And the other thing, let me just do one more thing. I just want to remind the students too that there's nothing bad comes to you if you share your contacts with us. Trust me, we don't share them with Dr. Carmona or Dr. Robbins. We don't let them know about them, but we do work that from a public health perspective.
Yeah, I would go, Bobby, even in our, when we start our own tracking tracing internally, we give the same message, Terry. You know, there's no retribution. We just want to find out who else might be infected. But I know there's that reticence that you're giving up this secret, but we're all in it together. Hence the importance of this partnership with city, county, and the university, because we're sharing 1.2 million people in a huge county that are moving back and forth all the time.
But I will, at least from the discussions I've had with the contact tracers, many individuals have reported that, and remember Charles, remember all of the students that came into our residential dorms were tested negative. And now we're starting to see these outbreaks. But I think for the most cases that I've heard about contact tracing, individuals have reported that they'd been to a large gathering, i.e. a party. That's why we have been so focused on trying to break these parties up, do things that would limit the capability of having these large gatherings. And you know, we can only be as effective as we can be, but we are working with the city, the county. In my opening comments, I read to you some of the highlights of things that we're doing. But, you know, we only have a limited time here. I know Dr. Cullen is very busy. So, Holly, let's probably move on. And if Charles has follow-ups, he can come back.
Yeah, he can absolutely come back to me as well. We've been in contact almost daily, so happy to answer those questions for you, Charles. Our next question comes from Craig Smith from KGAN 9. Go ahead, Craig.
Hi, for Dr. Cullen or anyone else who wants to pick up, I just want to clarify, when you're talking about more restrictive actions, are we talking about quarantines most likely in the fraternity sorority world, or attempting to impose quarantines elsewhere in the university community or elsewhere in the community at large?
Terry, go ahead.
Do you want to go?
Oh, go ahead, Terry. You go ahead. I'll follow up.
So I would indicate that right now, when we have found these high levels of transmission in a fraternity or sorority, we are working with them and we are asking them to isolate and quarantine. In this case, that word quarantine is the word that we invoke for the process we use when somebody is a contact. So it's not the legal way you may be interpreting that word quarantine. And so it gets a little confusing here. As we move forward and we look more closely at community-based transmission and we see what the data shows, now that it has a dependency, just so you know, on more aggressive testing, which we are implementing. We have been implemented, the city implemented that. We expect to have a high level of testing going on in the next 5 to 7 days. We will revisit what is appropriate intervention based on discussions with the city as well as the university. But I don't want to, the word quarantine has many reasons, has many definitions in this case. When we're using that, it's the process that happens when somebody is a contact, they're quarantined for 14 days. At the same time, we have asked the people in some of the sororities and fraternities to not move, to limit their movement, to not go inside or outside.
Hey, Craig, this is Rich. Nice to hear you back again. Thanks for being with us. To add to what Terry just said, you know, to the public health professional, isolation and quarantine have very definite meanings. To the average person, those words get thrown around all the time. The simple way to look at it, as Terry said, when we quarantine somebody, it's because we feel they're at risk. They've been exposed. As opposed to when we isolate somebody, you got the disease, we're gonna put you away for a little while because we don't want you to spread it. But in the general terms that, you know, the press and everybody else uses them interchangeably, even though scientifically they're not interchangeable. I think Terry gave a good explanation there. The other issue that I wanted to bring up is when we look at, to your question, Craig, there are simple things we're doing that really are ones that we try and restrict transmissibility. Like just recently, we had discussions with the president about restricting visitors to the dorms. Let's just keep all the kids in the dorm, period. Let's look about what outside visitors are coming onto the campus. So there's gradations of things that we can do that are short of a quarantine. But ultimately, if those aren't working, and we're almost there now, then you have to take the next step and say, okay, everybody's going to stay in this building for the next couple of weeks and do distance education. We'll bring you your food and so on and so forth. So it's not an all or nothing. There's a lot of things that are happening every day that the president is directing that we do. But when it comes to quarantine, then that's, you know, closing down a dorm, for instance, and saying, you all are going to stay here for this 2 weeks. We're going to feed you and take care of you, but you can't go out because we don't want you to be spreading infection. And as Terry said, when we start to see those positivity rates getting up 10%, to us, that's a bunch of vectors. That's a bunch of people in the building who spread infection. And we love them all, but we don't want them out there spreading infection. So those are the things that we're thinking through.
All right, and again, with Dr. Cullen, I'm just trying to clarify. I mean, it seems unlikely you're going to try to impose either of these terms, isolation or quarantine, on the broader community, but I just want to clarify that point. And also, please elaborate on the expanded testing you're talking about in the community at large. How would the mechanics of that work? Who would get them? Are you looking for tests for folks who just want test precautionary, or because there's something in their history that suggests they should be tested.
Okay, so let me clarify the one thing. Yes, we are not talking about isolation and quarantine in the greater Tucson community. Let me be very clear on that. Thank you for clarifying that.
I just had to.
Yes, I appreciate that you just did that. Secondly, in terms of testing, you are aware the county already supports 3 test sites. They are running full blast. We started a few weeks ago looking at vulnerable populations and doing what I have coined the term, and Rich will love this, precision epidemiology. You know, there's precision medicine. I think we need precision epidemiology. Our goal is to do targeted testing. We are already doing that in many parts of the community in Tucson writ large. We are now doing that specifically around student-based housing, and we are working with the off-campus housing at the university to identify areas where there is a high populace of students, and we are going on site and doing that testing, both antigen and PCR testing. And we started that last week, and you will see that accelerate in today and keep going until we feel like we're stable.
Yeah, but just to put a finer point on this, what we're really talking about is exactly what Dr. Cullen and Dr. Carmona were alluding to. And that would be to close a dorm or a sorority or fraternity house and restrict people going in and going out. And you can imagine, as they both said, that's fairly draconian, but this is what I think we've come to. We've educated, we've given everybody a chance, but now this is risen to the level where I think we need more strict intervention. Now, if you start thinking of carrying that to the next logical extension, would there be a high rise that had so many cases in it, you know, you would have to isolate, lock the high rise down. That's certainly something that we would have to really discuss, and there are all kind of legal implications that I don't think that we can work out here on this briefing. But we'll continue to have this discussion. Come back on Monday and let's tune in then. So sorry, Holly, go ahead.
We have time for one more question. I know we have a hard stop at 11. So our next question comes from, okay, well, I guess it's going to be a follow-up. It was Shaq Davis, but we're going to do a follow-up.
It's never good when the moderator freezes. Holly, are you there?
She's on
Oh, there we go. Now he's on.
Dr. Cullen and President Robbins and Dr. Carmona, you talked about the positivity rates in the Greek life houses, the sorority and fraternity houses. Are there any on-campus dorms of the whatever number of on-campus dorms there are, 23, of which I guess 20 or something are occupied? Are there any on-campus dorms with a positivity rate exceeding 15%?
I don't think so.
No.
I don't think so, no.
No.
You know, Charles, one of the things, the beauty of this, Dr. Pepper's wastewater-based epidemiology is to find those cases early because they're asymptomatic, because you're shedding before you get symptomatic. You know, as you will recall, the first dorm, there were 1,300, I think, 311 students in that dorm, and we found 2 positives. And, you know, I was a little disappointed. We went to all of that trouble just to find 2 positives, but we found 2 positive that would have, of course, gone out and infected other. Since then, we found more positives, but nothing that would get to the 15% level. In some of these fraternity and sorority houses, we're to those levels. Hence, that's why we're having this discussion.
So we do have, Shaq Davis is back, and I want to give him the opportunity, and this will be our last question. Go ahead, Shaq.
Appreciate it. Sorry about that. All right. Guess I may get a two-parter myself. I know we talked about last week about the outlook for the rest of the semester. I'm wondering if that may have changed. I think there was a date thrown out about September 28th, and looking at maybe extending out access to the university, but maybe I know that's a fluid situation. So I wonder if anything has changed there, and if there's also there was mention about the student code of conduct and the dean of students, and I'm wondering if there's been any maybe consequences dealt out from that office, or what has come from there, looking at these different situations. Thank you.
Yeah, Shaq, those are really good points. I think that we certainly won't escalate the in-person classes as we talk about every week, and on Monday we'll do our usual week out look. But as we've been discussing, as the Public Health Advisory Task Force that Dr. Cullen and her colleagues interact with Dr. Carmona on a weekly basis, and we're really looking at this every day. I mean, we all watch these numbers every day. I think you're going to see more restriction of activity, as Dr. Cullen pointed out, and we referenced University of Wisconsin. The issue around are there any cases that have resulted in discipline through the Dean of Students office in the Student Code of Conduct? I'm not aware of any so far, but I do know that there are individuals that the Dean of Students has received reports about, and they're in the process. But I'm not even sure we could tell you about it if there is. But I do anticipate that there will be punishment for going beyond what the education phase, even the warning phase. We're warning you, you get a warning, and you continue to have the activity that we warned you against. You will see some sort of punishment for that conduct. But I'm not aware that we've had any to date.
Yeah, I think to add on to what the president said, ICS has had multiple discussions with the university leadership, including the dean's office, about the issue of student conduct and how these might be best handled. But I agree with the president. I don't think anything has come of that. But in anticipation of what the president just said, that we're going to have to start doing something because we've gone beyond education and inspiration and cajoling and asking and begging. We have to take some firm action. The other question, part of the question was about the September 28th. Our FAT team and others had modeled out certain dates that we might look at to either stop or go forward based on the metrics at that time. The metrics at that time now tell us we're not moving forward at all. Absolutely. But again, you got to go back a month when these documents first came out. We didn't know things were looking good. And we said, okay, if things look good, we might start moving forward on this date. Now things are not looking that good. So we're saying we're going to stop and look at this very carefully. We may even have to back up a little bit based on these numbers. And that's hence why we're so closely aligned and working with the county and the city to make sure that we have a lot of smart people looking at the same numbers and making the best recommendations to the president so he can make his best decision.
That is a perfect way to end because it's exactly 11 o'clock. So thank you all for joining us. We look forward to seeing you again on Monday, and the recording will be ready for you and posted shortly. So remember, bear down and mask up. Thanks.
Thank you. Bye-bye.
Thanks, Dr. Cullen. Bye-bye.